Diagnostic imaging is a fundamental tool for healthcare providers, such as a lumbar myelogram, one essential invasive procedure, typically for patients with contraindications to MR, pre-surgical evaluation, and or to rule out cerebral spinal fluid leak. A lumbar myelogram utilizes a needle filled with contrast directed into the spinal cord, followed by a series of X-rays. Ultimately, a myelogram is used to highlight any potential nerve root compression or masses, which involves many preparations before, after, and during to enforce everything runs smoothly. Steps before the procedure. All patients are to be screened for any medical conditions and daily medications, in case some should be discontinued days prior. Most importantly, will the patient need to be pre-medicated due to previous allergic reaction? Day of the procedure. Patients should be on an empty stomach for roughly 3 to 4 hours, depending on the radiologist group and or at the facility's discretion. Myelograms are performed in the X-ray room by a radiologist, who is assisted by a radiologic technologist at times, to maintain a sterile environment. The patients are to lay on their stomach, exposing the lumbar to be sterilized. Once that is done, the radiologist looks at the spine under fluoroscopy, obtaining real-time moving X-ray images. Lidocaine, local anesthetic medication, is administered in preparation for a spinal needle. The radiologist sees the fluoroscopy image, guiding the needle to confirm good positioning for contrast material to be inflicted. After succeeding, the X-ray table is tilted in different directions, allowing contrast material to travel all throughout the spinal cord. After examination, patients are instructed their aftercare, symptoms they should be concerned about, and who must be notified. For starters, resting for several hours, drinking lots of fluids to help flush out that contrast, and limiting physical activity following the myelogram is encouraged. During the procedure, patients are fully conscious, therefore, holding still is crucial in determining the injectable site. Finally, the grand purpose behind a lumbar myelogram are for doctors needing additional information, even after MRI and CT testing. The evolution towards diagnostic testing comes as a huge responsibility for providers to select the most appropriate study based on the patient's history.